Narayana Health has pioneered a lot of low-cost healthcare through the process of centralization, right? They have a lot of really great facilities like Narayana Health City, where they're able to get, incredible automation, some incredibly powerful machines that allow them to provide high-quality, low-cost healthcare to everyone. I think Airbound fits in really well with this vision because one of the major challenges, let's say, Narayana Health City faces is being in Bombasandra. You can't provide access to everyone with just one facility, right? A lot of people have to go there, and that makes it a suboptimal experience for customers. This also becomes a big challenge for people coming from outside the city or other areas where it's not economically viable to build the level of infrastructure that powers Narayana Health. With these drones, you gain the benefits of centralization because now we can have these drones move packages, move medicines, move blood samples from far away to Health City. And that just enables a lot, right? It allows Narayana to double down on their thesis of centralizing and automation and allows us to just bring the samples in.
Right. But take me to the contours of the partnership. What kind of volumes are you looking at in terms of orders? What are the numbers involved by way of how many samples will you transport? Restricted blood samples, other medical supplies. Take me to some of the key quantitative and qualitative aspects of the partnership itself.
No, absolutely. I think there's a lot of excitement, with Narayana on this. I think they see the vision that we have, and so they really want to move towards a world where Airbound is powering, pretty much all of their deliveries. This is, a pilot project, and so we are really just proving out the initial contours of the system.
Beyond Narayana itself, what's your order book looking like? Have you also spoken to other partners, other segments beyond healthcare that you are also hoping to get involved in and carry out deliveries? What's that pipeline and that order book looking like?
Absolutely. I think healthcare is the right place to start with drone deliveries. But at the end of the day, our vision is to make drone deliveries viable everywhere, right? It's not that, hey, this only works for really critical, healthcare deliveries where people can afford to pay a few thousand rupees for it. Or it's not like this is needed in, super out-of-the-way areas with zero infrastructure, where, roads don't really work. The idea is that this should work even in the most ideal cases, even in the most advantageous environment for roads and traditional delivery. So naturally, the question is, why limit yourself to healthcare, right? We want to, it's kind of like, you wouldn't ask Yulu about are their bikes going to be used for healthcare deliveries, for like food deliveries. It can deliver anything. It's a bike, right?
So which segments do you have right at the top of your mind?
So I think a couple of segments that, we care about. Obviously, we're looking at, quick commerce, food delivery, a few layers of e-commerce, at least whatever we can do with our payload. There's a few interesting segments opening up, when it comes to fashion deliveries and a lot of, I think, new kinds of deliveries that we can enable when the cost of delivery is very low and the speed of delivery is very high.
As things stand, what does the horizon look like when it comes to beyond visual line of sight operations of drones itself?
The regulations have been worked on for quite a while. We've been involved in a lot of these drafts. We are hopeful that we'll start to see a draft bill come out by the end of this year. But unfortunately, with these timelines, you can never say for certain.
Right. I want to bring you up on another thing you just mentioned, that beyond regulations itself, costing is a massive challenge. Now, a number of players in the space have spoken about it in the past. You have as well, by talking about how costs can, to an extent, be controlled by building lighter planes and by ensuring that, minimal input goes by way of carrying these operations in the cost front by a function of its mass and weight. Is that something that you are working on? And if yes, to what extent or to what function can your cost factor be brought down?
Oh, you would be surprised the amount of improvement you can have, right? I think a good way to think about this is there's been a lot of studies on the cost of EVs when you're moving around. I think generally numbers put it at between 1.5 to 2.5 rupees per kilometer, right? So you can essentially think about this as the cost to move 150 kgs of mass from point A to B with current technology is about 2 rupees per kilometer. Now, we don't need 150 kgs. In fact, our whole system can be sub 5 kgs. And so the end state that we see for this is you're reducing mass by 30x. Our math says that with a 30x reduction in mass, you can get a 20x reduction in cost. And that's where we're able to see a future where the cost of delivery comes down to just 10 paise per kilometer. That's how we can enable a world of 1 rupee deliveries.
And interestingly enough, even as you announced this round of funding itself, how much of a runway do you have with these funds before you choose to go for your Series A round? What are those timelines looking like?
I think the interesting thing when it comes to hardware is that runway is really a function of ramp up. right? And I think this is where, because we have strong momentum on our sides, we're really looking forward to raising a Series A fairly soon.